Okay, I think in the interest of time, we're going to go ahead and get started. Erin, if I could ask you to kind of keep an eye on the door if people come in to get them the materials and stuff that they need. Welcome. Thank you, everybody, for coming after we had our little snowstorm. I call it little. We live in Wisconsin. Come on. Our snowstorm last week. We're happy you all can make it now. Before we get started, I just wanted to bring attention to the sign-in sheet. I'm just going to pass one around. I just did a blank sign-in just to make it easier, but the question that we're asking this month is we're going to be looking at offering CEUs potentially if people do online viewing. So if you don't make it in person to the meeting, that you could do online viewing to receive that 1 credit. So we're kind of looking at what that might look like or how we might do that. And what we're asking is that if we do that, there's going to be a little bit more labor in that. What if you would be willing to pay for that CEU credit? Because right now we're able to offer them for free, which is awesome. We're really excited about that. But that's just the question. So if yes, no, or unsure is your answers. And as always, if you have any in-kind time, being you did any work outside helping to promote the AOD partnership, any mileage that you may have accrued today, any type of things that you've donated to our cause, to our mission, if you want to include that on there as well, that would be great. So just calling this meeting to order, as I said, we are starting in 2016 to offer CEUs for all of our AOD partnership meetings. So if you did not register online before the meeting, you can fill out a registration form. They're over there, right by on the end of the table, and hand them back to us at the end. And we'll make sure that you get those CEUs. And essentially, if you need continuing education credit for anything, you can request your transcript and it'll show all your meetings, and you get 1 credit hour for attending today. So we're, again, really excited to be able to do that. And any other special trainings or meetings that we have throughout the year, we'll also look at offering CEU credits for those too. So it's a great opportunity, especially when money's tight and we're trying to get those CEUs in. One of the things that I'm going to be requesting in our weekly update this week is, and the next couple weeks, is some feedback from our partners on what you see as the value of the AOD partnership. What is it that they bring to you, to your organization? What kind of things do you like? Also, what kind of things do you not like? You'd like to see improvement on. So we're really just going to be looking at a very basic soliciting feedback. And this is going to be in addition to our annual partner survey, which will come out in a couple months. So this is just something that we're looking for some quick feedback on. Also, I want everybody to save the date for our 6th annual Spotlight event. Going to be held April 5th, which is a Tuesday. It's the same Tuesday as our next AOD partnership meeting. And this year's theme, we're going to be looking at growing healthy youth and kind of helping to support youth development and how we can prevent youth from even starting using substances. So that is going to be held at Jefferson Street Inn. It'll be in the evening again. And our nomination forms, we always do spotlights. Spotlight awards on individuals and organizations in the community helping us achieve our mission to eliminate the misuse of alcohol and other drugs in the community. So those nomination forms will be coming out in the next couple weeks. So we're going to be soliciting some of those back from folks. So if you have anybody in mind that you feel maybe is under the radar, people don't necessarily know that they're doing such great work, to send them our way, because we really like to highlight those folks in our community. So with that, I think what I'll do is turn it over to Joanne Kelly with United Way. She's the executive director there, correct? And she's going to talk about the latest life report. Did anybody go? I know a couple people did. So a couple people went and heard the kickoff. We're just going to kind of highlight some of the things in here. So I'm just going to stop talking now. Here you go. This is the bottom button.
Thanks, Melissa. And can I see those hands again? How many know what the life report is or attended? Okay, most of you. Great. Well, I only have 10 minutes, so that's good. We'll go through the update fairly quickly. Our community has been coming together to prepare the life report for our community. And really what we look at are those 3 goals: acknowledge our strengths, identify our greatest challenges, and then be a catalyst for change in our community. We have been doing this for 20 years, so this is the 10th edition of the Life Report, and we continue to evolve and improve It's very much a report that's owned by the community. We couldn't do it without our sponsors, so here's where a lot of partners giving a little makes this project possible. And many of these partners have been here since the full 20 years or 10 reports. So we're grateful for them. But I think what we're most proud of is that the community really owns this report and looks forward to the results. But by owning it, they also contribute to it. So when each section in the report gets developed, we use community experts to help develop, identify what data is out there, help us identify how to present the data and understand the community issues. Part of the main section of the report, and there's the snapshot on the side, but the main report's available online, or you can pick up copies at the United Way office. It has a section for each topic area, but it also has information about calls to action. So in our report this year, in one of the sections, in front of each section, it talks about what you can do, what your organization can do, and what the community can do around these topics. But new this year are 12 videos, and we're going to look at one or two of them after I go through the PowerPoint. And I encourage you to go in on the website and look at those videos and share them on social media. They're just 1 or 2 minutes each on the various topics. We also have interrelated issues. So when we saw education as a section, a child's well-being crosses many sections of the report. So now there's an icon on each page of the section to help us identify those. These are the 6 sections, and we have 6 subcommittees that work on those sections and developing the indicators. So there's 62 indicators in the report. But what we do also as a group is step back and say, what is our community strengths? And we do identify many strengths. So it's like anything, you look at where do we need to improve, and that's where you end up spending your time talking. But we shouldn't forget that our community has just some fabulous strengths. Community resource richness in terms of healthcare and education system, natural resources. We're a regional center for employment, for tourism, for arts. And then one thing I think we're most proud of as a community, and you're part of that, is our coalition work. That people in this community come together, they are passionate about different topics, and they help us find community solutions. For about 5 reports now, we've identified aging as an issue to watch. So it hasn't made the top few priorities, but it's one that we see on the horizon and one that we're trying to pay more attention to, an issue that we're trying to get our hands around in terms of the data. How are we doing as a community being prepared to address the needs of our aging population? The top calls to action, when people ask me what surprised me the most this year, because I've been involved in all 10 reports, and I think what surprised me the most is when we had 25 community leaders sit around the room, having looked at the data, having their own knowledge and experience, they quickly came to this same agreement and the summary of these issues. Last year, we identified, or 2 years ago, a Great Start for Kids as a long-term call to action. But so important to helping those kids succeed are those other issues of mental health, substance abuse, and income. Mental health is the first time that we've really seen that rise to the top. And I think there's a number of reasons for that, but it is intertwined with people's success in life, with kids' success in life, and we're seeing more and more behavior issues, hearing more and more about behavior issues in our schools, in various places in the community. Substance abuse isn't one I need to tell you about, but we're really thankful that you guys are caring enough and working to figure out how we can reduce substance abuse in our community. One of our members, or many of us, when we saw this, oftentimes these are things we as a community don't like to talk about, mental health and substance abuse. You kind of like to push that under the carpet, but it's clear that these are issues that really need attention. And certainly intertwined is income. If families don't have adequate income to meet the needs of their own success, oftentimes maybe because they have substance abuse or mental health issues, the whole family and community suffers when that occurs. When we talk about a great start for kids, the research out there, of course, points to those first 5 years, 4 or 5 years before they enter the public school system. Great public schools here, but we need to make sure families have the tools and resources they need to raise great kids. At our Life Forum a few weeks ago, we brought in Dr. Dipesh Navsaria. His talk is on our same webpage as the Life Report. And if you have an hour, it's well worth spending some time listening to him talk about the challenges that families face and how we can help kids have a great start. It's a 2-generational approach. It's not one thing that you can just do for a child. It's multiple things you need to do for the child and the parents and the family. With that, we encourage you all to share the report on your website, on any means you have possible, and also to get involved. You already are. We can come out and speak, spend a little more time talking about these topics. We encourage you to share the videos on Facebook, and of course pick up the reports and become familiar with your community. The videos really were provided through a grant, but also 25 community experts came together and taped, their conversation about what's going on in our community. And I think we'll start with the mental health one.
Sure.
Melissa's going to help me get that
Oops. Of course, I didn't pull that one up, but I can pull it up very quickly.
Which one did you pull up? We can show that too. Yep.
That's okay.
Yeah.
It's quick.
When good mental health is absent, it becomes a contributing factor to many other individual, family, and community challenges.
Mental health is a community issue, and schools are a reflection of the community. Starting at an even really early age, as early as kindergarten, we're seeing behavior issues and mental health issues. It's really hard to focus in school, whether you have a mental health issue or something's going on at home with one of your family members. Think about studying for math. Not real easy when you're worried about what's happening at home each day.
We're spending almost over $5 million in addressing the symptoms that are often a reflection of other underlying mental health issues. What we're finding is the people who are coming into our criminal justice system who often have children, who often are neglecting their children, have significant underlying mental health concerns as well.
There are limited counselors, certainly limited psychiatrists, especially child psychiatrists, that can even see people. And so as a community, I think we need to come together and make sure we have those resources and staff available.
Taking steps to acknowledge and address mental health issues will impact many aspects of our community in a positive way.
To learn more or get involved, go to unitedwaymc.org.
So there's also one on substance abuse, as
Marathon County continues to face challenges pertaining to alcohol and illegal and prescription drugs.
Substance abuse crosses all socioeconomic backgrounds. We've seen prominent business persons that have been involved in the product who sacrificed their...
in an effort of the United Way to bring the community together. And it had 3 main
Sorry,
objectives.
everybody.
One was to acknowledge
Technical difficulty. Let's try that again.
businesses, their...
We'll start that over.
Marathon County continues to face challenges pertaining to alcohol and illegal and prescription drugs.
Substance abuse crosses all socioeconomic backgrounds. We've seen prominent business persons that have been involved in the product and have sacrificed their businesses, their careers, just because of the addiction. When you look at any social event that takes place in this community, Usually alcohol is served at those particular events, and it's a draw.
When a teenager drinks alcohol, they have a 6 to 8 times greater chance of becoming addicted to alcohol because of the brain not being fully developed. Unfortunately, in Wisconsin, it's legal for parents or guardians to give alcohol to their underage children. We know that addiction, it can be genetic, but it also can be learned behaviors.
Substance abuse is a huge issue. 75% of those persons that are booked into the Marathon County Jail are there for some type of substance abuse problem, whether it be from sale or trafficking to committing offense while under the influence of a particular product, or committing an offense to support a habit or an addiction.
It doesn't matter what the person is using, you have to understand why they're using. So I think that's the number one thing that we have to tackle. Understanding and openly discussing both drugs and the more accepted use of alcohol will be a step toward changing the culture.
To learn more or get involved, go to unitedwaymc.org.
Any questions? Well, thank you. Appreciate your interest in helping make this a better place to live.
Okay. And if you haven't been to the United Way site, this is what the Life site looks like. Here you go, Joanne. So you can download all the different components of the full report. You can look at the videos. You can download the snapshot, which again is available over there if you didn't get one. I'll pass around my copy of the report. I was tabbing. I'm a tabber. All the alcohol and drug related ones in each one of the sections, but you can kind of see what it's like if you haven't seen one. Don't take my copy though, please. But you do have a card how to download it online. Thank you, Joanne. Okay, a couple partner updates. In front of you, maybe not, you do not. Over on the resource table is the Healthy Marathon County Annual Report. And for those of you that don't know, Healthy Marathon County is an umbrella organization that helps to support a number of different community coalitions that are tackling different issues related to health. Could be dental, could be aging, looking at suicide prevention, tobacco, obesity. They're all kind of rolled up within this group. So I gave you a copy of their annual report. It is a resource. AOD Partnership does fall underneath them as kind of the leading arm in substance abuse prevention efforts. Before I get to Debbie, I'm going to have you come up here and talk about the conference. I'm just going to go over a couple things that are on the announcements. Evaluations are in front of you. Please, please, please make sure you fill these out, even if you have to leave early. And you can leave them at your spot, or we could start a pile. It's probably easier to leave them at your spot, and we'll pick them up. Couple things, we've added some different questions. This time, just asking about if people are looking for CEUs, looking at how likely you are to use this information in your organization or in your life, essentially. So please take a moment to fill those out at the end today. They're very helpful to us in justifying funding. For example, last year in 2015, on average, our participants at our meetings increased knowledge by 17%. So I mean that's kind of a cool little outcome that we've had. Already talked about the Spotlight event. Again, if you hear anything, you see anything, you see a news article, what have you, share it with us. Share it with me, and we'll send it out through the update. I've got a lot of great videos that have come through, resources, and so on. Our next AOD partnership meeting is going to be looking at the link between substance abuse and interpersonal violence. It's Alcohol Awareness Month as well as Sexual Assault Awareness Month. So we're going to be partnering with the women's community to have a panel that's going to feature women's community. It's going to feature the SANE nurses over at Ministry St. Clair's, and that's the Sexual Assault Nurse Examiner Program, as well as someone from the District Attorney's Office, hopefully here as part of our panel, so it should be another great learning event. All of our meetings are always on our YouTube channel, including some of our special events are on there as well, so please feel free to view those. And the next meeting for Western Marathon County Healthy Communities is March 16th from 8:30 to 10, and it's going to be at the Corner Kitchen in Edgar, which is the gas station restaurant right off of Highway 29. Very exciting. Western Marathon County is looking to secure DFC funding, Drug-Free Communities funding, which the AOD Partnership was able to benefit from for 10 years. So they're going to be looking at targeting issues just like AOD partnerships, we'll be able to really build our capacity as a county, looking at things like underage drinking and prescription drug abuse. So we're really excited about the fact that they are going to be doing that. And with that, Debbie, if I could have you come up and talk a little bit about the medication conference, and then we'll open it up to any other partner updates.
You'll have to excuse me. I was traveling, and guess what I brought home on from the plane?
Do you want to come up here?
Sure.
Just because then it's on the mic here.
Oh, I see. Okay. So I have a number of these brochures sitting on the table for you to take with you. We are hosting a prescription drug medication abuse conference on the 25th of this month, a little over 2 weeks away. It will be held here on campus at the health building, so across the parking lot over there. We are up to about 150, 160 people already registered. We've only got room for 190. So if you are interested, please grab this and register as soon as you possibly can. Some really cool things that we have as part of this, we have someone from the prescription drug, help me with that again.
Prescription drug monitoring program.
Thank you, monitoring program. Where prescribers register when they prescribe medications. We've got someone coming from that to talk about why we should be doing it, how we need to be doing it more, things like that. Monty Stiles, I don't know if any of you have ever heard of Monty Stiles, excellent keynote speaker. He's going to be starting us off and doing some trainings with public and law enforcement. We also have Brad Schimmel, our Wisconsin Attorney General, coming. He's going to talk about the Dose of Reality campaign. How many of you have seen that on TV so far? Those commercials? There's one that's a young man, the mom's trying to wake him up. And the other one where a bunch of kids are at a party and the girl won't wake up and they're trying to wake her up and they start taking off, things like that. And there's a third one that's coming out very shortly. He's going to be coming and talking about that campaign and what we can do in our local areas about that. But I guess that's all I really needed to say about it. All the breakout sessions, who's speaking, are on this brochure for you. We have Dr. O'Connell coming as well from Aspirus Clinics. He runs the residency program here in town. And he's going to be talking about how families, each of us personally, and prescribers can work together to help stop overprescribing, prescribing too strong of medications, and what to do, other methods of taking care of yourself other than getting these strong opiates and things like that for that pain medication. So just some ideas and some examples of what you can see. So with that, thanks.
Wonderful. Again, like she said, 5 credit hours for that conference, $35, cheap. Just saying, you're getting lunch, continental breakfast, you're pretty much paying for your food. And you're gonna get a resource flash drive of all the materials from the presenters for that as well. So definitely well worth the investment. I'm gonna guess that they want you to register within 48 hours of the event, so register soon because spaces are filling up, just so we can make sure we get you a lunch.
It'll be either by next Monday or excuse me, the Monday before, or or when we're full.
Yeah.
When we're full is probably going to come sooner.
True. One other partner update before I open it up to the room is CDC Vital Signs. If you've never seen them, the Center for Disease Control has a series of vital signs, and this is just kind of their homepage, but you can break it open by topic. The latest one related to alcohol is looking at alcohol and pregnancy, for example. So you can really pull down a number of great, wonderful fact sheets. So if you click there and you go over to the side, you can download the fact sheet, and it's very easy to hand out, which is why I bring it up. They print off really slick, and they're usually 4 pages. They include kind of what is the issue, and then some great infographics, some great pictures you can use in your organization, as well as some of the what can be done by different levels of the community. So just want to point that out to you. I'm going to be sending out a link in the weekly update this week, and if you're not familiar with the weekly update, it's an email that we send out as an electronic newsletter. It includes meeting announcements, training opportunities, new resources, things that you may see in the news. It's really more than just Marathon County. We do share trainings that are happening around the state as well. So you will get signed up for that automatically today. And again, make sure that we're passing around the sign-in and it hasn't stopped and got delayed. Any other? I know Kate had an announcement. I know you're back there. So if I could have you speak loudly so it gets picked up here. Okay.
I'm Kate Gaines with Naomi, and we have 2 events coming up in the spring, and we'll probably send out more information. We don't have flyers made yet, but on April 7th, we'll be holding a Poverty Action Day that'll help identify the start of a poverty task force for the area and identify which issues we want to get started on first. So that's April 7th. And then May 1st, we'll be working with the UU Church doing a March for Racial Justice. So that'll be going on that day, and I'll get more information out to everybody.
Perfect. And I'll make sure I share those through our update, so you'll be able to access those resources as well. Any other partner updates? All right. To keep with time, I'm going to go right into our presentation then, because I am the lucky one that's up first. Hopefully, Joanne did not steal the clicker.
Is it right there?
Whew. I was like, oh no! Actually, I'm going to probably stay back here anyway. So today's topic is looking at harm reduction. I know that's kind of a random term, a term that not very many people have heard of. So within your packets, you have a handout that has the principles of harm reduction, which I'm going to go over just very briefly and how it's linked and how it plays a part in addressing addiction and recovery. There's a lot of misperceptions about it, so we're hoping that some of our presentation today will help ease some of those misperceptions, as well as give you an opportunity to ask questions as we go along. So when we look at addiction, quite simply, this is the best definition I've ever seen through the American Society of Addiction Medicine. It's really an equal opportunity employer. It doesn't matter who you are, it doesn't matter what you make, where you live, where you grew up, did you go to church, did you graduate college. When you look at addiction, and this is any addiction, but for today's purposes, we're going to be focusing on substance abuse and addiction. This is the best definition I've seen. It breaks it down very simply to inability to abstain, the impairment of your behaviors, that you can't control your own behaviors, that you have a craving or increased hunger for the drug or that rewarding experience. You can't recognize the fact that it's messing up your life, quite simply. And then finally, just your emotional response. If somebody comes to you and says, I'm concerned about your drinking, that you may just jump all over them and not recognize where the issue lies. And addiction really is a complex issue. It's really kind of intertwined and tangled, and that's why I have these two images up there. There's really no one answer. There's really no solution. There's really no organization, entity, individual. There's no programs that we could put into play. There's no one-shot deals. It's so complex. And that's why when we talk about addiction, we look at it as a wicked problem. There's not one type of thing. It's like baking a cake. We can't just follow a recipe and expect change. It's really intertwined, and that's why it's so important that when we talk about addiction, that we look at it from different facets. Majority of the time we talk about prevention, treatment, and enforcement when we talk about addressing and working with substance abuse, misuse, and addiction. And really what we're talking about today is the importance of harm reduction. So really it's a 4-pillar approach. It all supports us being able to support those in recovery, to be able to start addressing addiction, and to help decrease. When we talk about harm reduction specifically, harm reduction really helps us decrease the harms that are in drug use. And we're going to hear about a number of different programs and opportunities today, so I'm not going to go too much into that. But it's really looking at policies, programs, and practices. It's not just one program. It's looking at policies. One policy that I always like to point out with this is that, for example, when you fill out a job application, there's one checkbox in there that rules you out from most employment, and that's that have you ever committed a felony? When you look at trying to support someone that's in recovery, they could be in recovery for years and years, but the likelihood of you having a felony or some sort of criminal record can prohibit you from getting most jobs. It'll toss you out of the stack immediately. That's one of those policies and practices that when you think about harm reduction, if we want people, like Joanne said, with it being all intertwined, if we want people to be able to support themselves and have a good income, we need to look at policies and practices such as banning the box is what it's commonly known as. So the goal of harm reduction is really that prevention of harm, not preventing the drug itself. And I think that's an important thing to remember, and I think that's one of those things that is really a sticking point with a lot of people. And that's why we wanted to make sure we have some information on some of the harm reduction things that are happening in our community. Again, looking at aiming to reduce the negative consequences associated with drug use, one of the main consequences is the spread of infectious disease. Specifically looking at the spread of diseases such as hepatitis C. We're going to hear more about that today, but that is the goal. That is proven for the needle exchange or syringe exchange programs. That's why we do those. We're stopping the spread of disease, and also being able to link folks to resources that they need when they're ready. Again, that movement for social justice, which is a big push, Naomi, a great group, that is their group. The North
Central area congregations organized to make an impact.
There you go. North Central organizations, whatever. No, I don't say whatever like that. But Naomi really pushes for social justice. And like I said, when you look at that movement, it is looking at, respecting the rights of those who choose. With addiction, you don't necessarily choose, but those that continue to use those substances. And again, it's looking at meeting people where they're at. So it could be encouraging safer use, for example, using clean syringes. It could be looking at managed use. It could be looking at abstinence. And then, it's really, again, looking at where people are at and addressing those conditions as they go. But I think this last section here, it's really looking at the individual and the community in which they live. If you it's like the duck in the dirty pond analogy. You take the duck out of a dirty pond, you clean them up, they do great, they thrive, they do well, they eat, they look great. You put them right back in the dirty pond, you can expect the same results. And when you look at substance use, we have to remember that those that use frequently live with, hang with, work with others that use. So until we look at the community as a whole and change the community as a whole, we cannot expect those that are working through their recovery to be able to sustain that recovery without adequate support. And again, one of my goals for today is really help to dispel some of those myths around harm reduction and be able to really make the case on why it's important when we look at addressing substance abuse in that prevention, treatment, and enforcement to add that fourth arm to make sure we include harm reduction as a part of that. So with that, I'm going to turn over to Carly from the AIDS Resource Central of that. I'm messing everything up today. AIDS Resource Center of Wisconsin. I always want to put Central Wisconsin in there. Would you like the clicker?
Yeah, that works. Thank you.
Did you want to stand back here? Or did you want to stand there?
I'm fine right here.
Okay, good. I'm going to sit.
Okay, so like Melissa had said, I'm Carly. I'm with ARCW, AIDS Resource Center of Wisconsin. I am with the prevention office there. I've been there for about 7 months or so. And I'm loving my job. So if you're ever wanting to stop on down and visit, I'm there. So, a little bit about ARCW. ARCW is at the forefront of HIV prevention, care, and treatment, and is dedicated to providing quality medical, dental, mental health, and social services for all people with HIV. So some people think, okay, what is ARCW in general? It's pretty much anybody in the state of Wisconsin that becomes HIV positive can choose to receive our services. So our services could be initial help with getting that initial doctor appointment for further testing. It could be finding or getting insurance and then getting the right medications and help with housing and legal services and food pantries and pretty much all of that. So I'm with the prevention portion of that. So I focus on prevention and then harm reduction for HIV and hepatitis C. So ARCW has 10 locations throughout the entire state. The closest one to here is in Schofield or our Wausau office. Otherwise, closest to here would be Eau Claire, La Crosse, Appleton, and Green Bay. So, the services that are offered are our medical clinic, dental clinic, mental health clinic, social work case management, food services, housing, legal services, pharmacy, and prevention. And then prevention services, which is mainly what I do, includes running the clean needle exchange, HIV, hepatitis C, and STD counseling, testing, and referrals, condom distribution, and education during community outreach. The services that are offered at our Wausau office, because it's only a 2-man office, would be prevention, which is me, and then we also have case management there, and then food pantry as well. So some people question, how are we funded? As ARCW as a whole, it's funded by federal, state, and local government grants, foundation, corporate, individual contributions, special events like our AIDS Walk Wisconsin that happens every fall in Milwaukee, United Way, and contractual partnerships, like the Medical College of Wisconsin, which works with our pharmacy and the medical clinic, and then reimbursement for services. So as my baby is the needle exchange, the clean needle exchange. So looking at the clean needle exchange and how it relates to harm reduction, the goals of the clean needle exchange is to prevent disease. So we're preventing disease by providing the sterile injection equipment to prevent HIV or human immunodeficiency virus and HCV or hepatitis C. Reduce mortality rates by providing overdose prevention training and Naloxone or Narcan distribution. We'll talk about that more later on. And then for those individuals who do overdose, providing them with the knowledge and skills to then link themselves onto medical care. So not only did they just overdose and they're not going to be afraid to call an ambulance, they're going to take those further steps and make sure that it's not just a 20-minute overdose and it turns into getting themselves into some more help. So, and then treatment for drug dependence. In a perfect world, we would want everyone to just stop cold turkey, but that's not the case. Some people may need help. So they can, by seeking treatment, most treatments offer the types of drugs to help, not necessarily replace the opiate or whatever drug they're misusing, but those drugs could include buprenorphine, Suboxone, Vivitrol, or methadone maintenance. And then the last goal is empower communities and reduce the stigma of drug use. So you may ask, does this really work? Does the needle exchange really work? Syringe access programs are the most effective evidence-based HIV and hepatitis C prevention tool for people who use drugs. Recently, there have been seven federally funded research studies that found syringe exchange programs are valuable resources in communities. And in cities across the nation, people who inject drugs have reversed the course of the AIDS epidemic by using sterile syringes and harm reduction practices. So in communities the needle exchange is present at every one of our offices. So there's 10 throughout the state, and then we also partner with local health departments and some other community organizations. So in each community that has a needle exchange present, the amount of new HIV cases go down by 86%. So just by having that present. So we know that having a needle exchange present helps. So we look at what needle exchanges do and what they don't do. So they don't encourage drug use. People who have a substance problem, they're going to use that substance whether or not they have access to clean equipment. Needle exchange does not increase crime rates, and it does not increase needle stick injuries in the community. What it does do is it reduces the amount of HIV infection, reduces risks for hepatitis C infection, and links participants to drug treatment, medical care, housing, and other social services. So we look at the big picture. Why should we have a clean needle exchange present? Why focus on harm reduction? Well, over 8,000 people are newly infected with HIV every year due to syringe sharing. Get that right? And that's nationwide. So, and alone in 2014 in Wisconsin, so I should back up. Wisconsin every year has an average of 250 new HIV cases. So 2014 was a quote-unquote good year, I guess, with less than the average of 226 that were infected. So of that 226, 6 of them were due to sharing syringe equipment. And then nationwide again, over 15,000 people are newly infected with hepatitis C every year due to syringe and equipment sharing. So if you think about it, if every single person, we only have 10 offices throughout the entire state, and my office goes from Portage in one county all the way up to Vilas, Forest, and Florence. So sometimes people are traveling up to 3 hours to access this. So if there was one in every single community, and just think if everybody had access to it, all of these numbers wouldn't be here. So you may ask, okay, she keeps saying equipment. What equipment is she talking about? So if you were to come in and access our needle exchange, it's not just syringes and needles that we give out. It's the syringes and needles, alcohol wipes, which is used to clean the area before injection, because if you don't, you're at high risk of getting abscesses and other bacterial infections. Cotton and just little cotton balls, because most individuals, after you're prepping your drug, you need to filter that drug because of other little plastic pieces or anything like that that might not synthesize down to a liquid. Most individuals may use cigarette butts. Cigarette butts have a ton of toxins in them, so we give them that cotton to help eliminate that. Cookers replace the spoons, and they're just easily able to just throw away. And if people reuse the cookers, bacteria can grow, and then they can give themselves another infection. Pipe covers, so individuals that smoke any kind of drug, when you're smoking, the pipe is very hot, it touches your lip, breaks your lip open, provides blood. So then I were to pass it on to Melissa, and then Melissa goes ahead and it breaks open her lips, and now I've probably infected her with either if I have HIV or hepatitis C in that process. And most individuals don't think about that. We provide ascorbic acid, which helps break down any kind of crystallized form of drug. It's safer for your veins to use that instead of vinegar or any other kind of acid. Tourniquets, which would replace any kind of belts, and it's just an easier way and healthier way to save your veins and your body. We provide condoms for contracting HIV or hepatitis C through sexual intercourse. Provide lubricants as well. Free HIV and hepatitis C testing to anyone that is high risk. Overdose prevention training to anyone that uses opiates. And then advice on safer injection practices and information on the safe handling and disposal of injection equipment. So our numbers from 2015 aren't in yet, but out of all of our offices in 2014, we exchanged 3,034,648 syringes. So that's not just what's going out, but what's coming back in. That's how many we've got back in. We've had 417 drug treatment referrals, 2,717 HIV tests, and 20 of those being positives, and 1,358 hepatitis C tests, with 292 being positive. And then we've also distributed 342,545 condoms for more prevention. I'll go ahead and pass it along to Stephanie.
While Stephanie comes up, just a reminder that there are materials over there from all of our presenters, besides those that are in front of you, so make sure you pick them up on your way out. Oh, thank you.
So my name is Stephanie. I am a public health nurse with the Marathon County Health Department. I have been there for almost a year and a half now. So and I'm here to talk to you about the needle exchange that we will be starting. Is it the download?
Yes, ma'am.
Okay. So first I'm just going to give you some basic information about hepatitis C. So it's a serious liver disease, and it's a viral infection that affects the liver. Also, it is known as a silent disease because a person can be infected with it and not know that they are. This is a bloodborne infection, which means that it is spread through blood from an infected person when it enters the body of somebody that is not infected. Hepatitis C is most often spread through the sharing of needles, injection drug equipment such as cookers, cottons, and like even the water that they use to dissolve the drug. Hepatitis C can be tested for, but it can take up to 6 months for the virus to detect it. There is a treatment available for the disease, but it is very expensive and requires the individual to not be practicing any high-risk behaviors. So no drug use, no alcohol abuse, anything like that. And as I said, hepatitis C can be costly for not only the individual but for the community. The average lifetime cost of hepatitis C in the absence of a liver transplant has been estimated to be about $100,000 for an individual. And if they do need a liver transplant, that can be $300,000 and up. And approximately 1/3 of all liver transplants in the United States are due to hepatitis C. Oops, hitting buttons over here. So some of the symptoms that hepatitis C can cause, so you can have fever, just a general feeling of being tired, decreased appetite, nausea, vomiting, dark urine, gray-colored stools, joint pain, and what we call jaundice or yellowing of the skin and eyes. Only about 20 to 30% of newly infected persons develop symptoms, and this is considered acute disease if they do develop these symptoms. And about 75 to 85% of newly infected persons develop chronic infection. And about only 15 to 25% of those people are able to clear the infection on their own. It can become chronic and cause liver disease, liver failure, liver cancer, and in severe cases, even death. We know that a person infected with a hepatitis C is also more susceptible to actually contracting HIV, which is another bloodborne infection that Carly has already mentioned. So this slide here, it talks about the increase in heroin and the increase in intervention. So since 2003, there has been a 526% increase in hepatitis C infection statewide for persons aged 15 to 29. So the heroin use in our county, there's been a problem. It's an increasing problem. It has taxed our legal system, our child welfare, jail, and many other areas in our community. And in the communicable disease world, which is a world that I work in regularly, heroin has been brought with it an increase in the hepatitis C, which I just talked about. As you can see on the slide here, so we're right in the middle, you can see that we have significantly higher numbers than those of surrounding communities. So, so from 2000 to 2014, we had 444 new cases of hepatitis C. And just for a reference, Clark County has had 92, and Taylor has had 31. So then, just in 2014, Marathon County has had 53 new cases of hepatitis C. We don't have our 2015 numbers in just yet. And persons aged 15 to 29 accounted for more than 1/3 of those cases. And infections in this group are attributed to the rise in injection drug use. So how does heroin and needle exchange fit together? So research tells us that the majority of persons with hepatitis C report that they share their equipment used for injecting drugs. Access to clean needles reduces the chance of disease transmission. You can see from this slide that 85% of individuals living with hepatitis C are reporting having shared equipment used for injecting drugs, and more than half of those have done so in the last 6 months. So needle exchange is supported by best practice by the World Health Organization, Centers for Disease Control, and the U.S. Department of Health and Human Services. If you are interested in handouts providing some of this supporting research, it's all over there, like Melissa said, it's on the table. There we go. So why Marathon County Health Department? So we do plan on starting a clean needle exchange, and we are hoping to have this up and running hopefully by the end of the month, but probably definitely we will be up and running in March. So the Marathon County Health Department provides services to individuals and families who are impacted by drugs and or drug use. The public health nurses at Marathon County Health Department We are trained and experienced to provide risk reduction counseling to people who use drugs. We also link people to addiction services, or we will be linking people to addiction services, and that will save on healthcare costs, morbidity, and mortality in the community. This will also contribute to our goal of being the healthiest, safest, and most prosperous county. As far as the needle exchange itself is concerned, we will be working in collaboration with the ARCW, or AIDS Resource Center of Wisconsin. One of us will get this right. And we will be focusing on individual counseling and working towards some significant outcomes that benefit the user and the county. And as of right now, we are planning to provide services to our current clients. So anybody that we do follow up with hepatitis C, anybody that we see in our current STD clinics, we have a couple of them based in the community. So those are the people that we plan on seeing right away, with the expectation that we're going to work with them with harm reduction counseling and referrals to treatment. So I think that brings us to
Okay, as Josh is coming up, I just want to point out too, we've talked a lot, mentioned heroin a lot with a syringe, with IV drug use. There's a number of drugs that you can use injection equipment with, so this does cover all of the drugs, but when we get to naloxone, that is specific to opiates such as heroin and prescription painkillers. So just want to put that out there. So it could be meth as well, or it could be cocaine, so just so people understand that. Okay.
Hey, thank you. So my name is Josh Finke. I'm the Deputy Fire Chief with South Area Fire District, or SAFE. If you're not familiar with what that is, in 2014, the town of Red Mountain and the village of Weston combined their fire departments to form one, which is now known as South Area Fire and Emergency Response District, which is obviously very long. So we just say SAFER or South Area Fire District. We see a fair amount of this. We cover both a urban area, being the town of Red Mountain and the village of Weston. We also cover some very rural areas. In fact, we cover the townships of Easton, Ringel, Marathon, Stettin, and Gunther. So we cover a pretty large area of the county, actually. And we definitely do have areas that are trouble spots for stuff like this, where we see more of the heroin overdoses and those types of things. So the basics of an overdose, and I'm going to apologize like somebody before. I'm right in the middle of something nasty here, so my voice might get a little crackly. But the basics of an overdose can vary a lot, depending on first of all, obviously, what the patient overdosed on, but the other thing is how much and how long ago and those types of things. But we're going to focus mainly on a drug like heroin, which is certainly a big problem in the community right now. So when somebody overdoses on heroin, they can be anything from as mild as just being very, very sleepy, to where it takes a little bit to get that person to respond to you, where you're either going to have to shout in their ear, maybe give them a little bit of some kind of painful stimuli to get them to come around. Or we may get calls of where, in fact, we had a little late last week where somebody just pulled in somebody's driveway, beat on the door, they said there's something wrong with my friend, they left, and the person was in the car blue and barely breathing, and it ended up being a heroin overdose. So they can vary quite a bit. There has been in the area several heroin overdose deaths related to these problems. So heroin has certainly become a big issue. So again, the biggest issue you're going to have is the patients, they'll just stop breathing. Whenever they take too much of this type of a medication, or not a medication, but a drug, they're going to basically stop breathing. So we've talked a lot about Narcan, and I have one in one of my pockets.
Whoops.
I did that wrong. And I'll pass this around as long as I can get it back, but so it comes supplied in many different forms. This is what's actually called a Carpuject. This is what we carry in our ambulances. Up here you see it in vials also. Most commonly it comes in these delivery mechanisms because they're just a little bit easier to give. Narcan is now able to be given by basically any first responder, including law enforcement in Wisconsin. So that was something that came around last year. To the best of my knowledge, unless you know anything different, I don't think any of our local law enforcement agencies are carrying it.
No, not in our county.
Yeah, I know that Everest Metro, Wausau PD, and Marathon County do not. So,
Wait.
mine completely.
That's the end of
This
what
is
I
the end of
made
mine?
for you.
Okay, no problem. So, Narcan is readily available, and I believe pharmacies are now even selling it over the counter. So people are having this at their parties if they know they're going to be using, and a lot of their friends will have it and those types of things. And it can be given in several different routes. One of those is intranasal, which is very easily given by basically anybody with really minimal or no training. So basically what happens is an atomizer goes on the top of that device right there. It gets hooked up to a syringe type mechanism, and you just push it and it puts it into very tiny droplets in the patient's nose. It gets absorbed pretty quickly. Within a minute or two you'll see a response and they will start breathing again. We will give it that way in the ambulance at times also. The more preferred route that we'll typically use is IV, so we'll start an IV and give it that way. It works a little bit quicker. The actual dosing of the drug is a little bit more dependable. So it can be given in many different ways. Another way that is commonly used, but not by healthcare individuals, is just intramuscular. So it's given right in, typically the deltoid, with just a needle, just like a shot that your child would have at the doctor's office. So basically right in the muscle. The problem with that is that it's much slower acting than it would be if it was given either in the nose or intravenously. So it does work pretty quick. The other thing is that people need to be cognizant of the fact that if they give this to a friend or family member or whoever that they're with, it may get them breathing again, but depending on how much drug they have in their system, the drug in their system may outlast the Narcan, and then they'll basically just have a relapse, and they will again have a problem with their breathing, so they'll have respiratory depression. So obviously these patients need to be monitored and treated at some kind of a medical facility. So there's been a lot of change with this lately. I can tell you that when they opened up for Narcan to be given to basically everybody, as far as law enforcement and lower levels of EMS, that the price of the drug probably at least tripled because there was such a demand for it. And now, and again, I don't know if you know the answer to this, but like I said before, I think they are selling, or are they already selling it at places like
Pharmacies?
Yes.
Yes, I'm going to get to that.
Okay, then I won't steal your thunder.
Don't steal my thunder.
So other than that, it is a very safe drug. It's given by us all the time when we suspect that maybe it is an overdose, but we're not really sure. We'll just kind of give it as a test, because if it wasn't an overdose, it's not going to hurt the patient in any way. So it is very safe for basically anybody to use. Any questions on that? Okay.
Good work.
Thank you.
And on the back of the Principles of Harm Reduction, Aaron, I have to give him kudos. I'm going to give him kudos twice. He was the author of the health and wellness section in the Life Report, as well as put together this nice little infographic on Naloxone or Narcan. Would you like to talk about the ARCW program?
So a part of the needle exchange is that we also encourage the clients to go through the naloxone training and then be able to leave with a kit. So Narcan or naloxone, we have naloxone, which is the off-brand, so it's just a little cheaper for us. It's still quite expensive. Blocks the effects of opioids and reverses an overdose. So we offer it to anybody that accesses our LifePoint needle exchange client, which would be the clients. I've also done trainings at AODA treatment centers for their staff members in case that they were to have any clients come in and overdose in their parking lot or on the premises or anything like that. And then we also encourage the training of family members of opiate users, so then that way they can help in need.
I have a question. Families of opiate users. So let's say you have a family member who is a user, who will not come in and get that. Can a family member come in and get the 5 doses and give them to that user?
So we don't have the 5 doses. So yes, as a short answer to you. What we give out to our clients is because of the demand and how much it's costing us. We've gone from 5 doses down to 3. So it's 3 single dose shots and then the muscle injector syringe as well.
So as a family member,
so a family member would
I know someone who's an IV drug
Yep.
user. I know they would never come in.
Yeah, you could come in and get trained. We just wouldn't give you 3 doses, we would give you 2 doses. 2 doses
Right.
and 2 muscle syringes. So yes, we encourage family members to come on in, because I know, and I read on the sheet that was made by Erin that in the state of Wisconsin, you don't need a prescription. We're still forcing prescriptions on our individuals, and the clients do not want to give us their names. So in that case where if you're a family member that your son or daughter uses, you can definitely call me up and I can train you. It'll take about 15 to 20 minutes. So we provide, like I said, we provide that training for our clients, 15 to 20 minutes. When I go into staff, AODA treatment facilities, I do more of like a 45-minute to an hour presentation, just because usually people have a lot of questions, and it's because they usually never used a drug before. So
So do you think these IV drug users, like, do people carry these on them? Because they know, I mean,
Can you
you're
repeat
an
the
addict.
question just so it gets people?
I
So
get that.
I'm hearing that your question is, do a lot of the injection drug users or the IV users,
Carry
intravenous
this on them,
users
just-
carry naloxone on them? Yes, they do. I give out an average 30 kits per month. So, and that's pretty low because I'm not pushing it, because it's pretty hard for my office to get refilled on it. So, yes, I would say probably 7 times out of 10, they're carrying it on them. And they come into me and complain, oh, the police officer just took it away from me.
And people know who has it. If they don't have
Oh,
it,
yeah,
they know
yeah,
who
yeah,
has it.
yeah. If like in that case where you have a family member that's using, more than likely, they know somebody that has naloxone on them. So I have certain individuals that come in and they get, instead of 1 kit per person, they may get 4 kits because they're the contact. Or if there's any overdose, they get called and they have to go respond. So that's a good question. So 2014's impact with ARCW on naloxone. We had 2,072 people that were trained, and 1,038 individuals that had been rescued. So that would be like, say Stephanie were to come in, she would want another naloxone kit. We have that conversation. What happened to your other one? Did it expire? Did it get taken? Did you lose it? Did you use it? They usually say they use it, and that was 1,038 people said that they used it. And then of the individuals that had overdosed, we were able to refer 215 onto treatment.
Why would the police officer take the kit?
Because there's some thoughts that if they take the naloxone away, they're gonna not use. So it's.
And they might also think it's part of evidence because
Yes.
there's a syringe involved.
Yes, so. Do you guys have any other questions on naloxone or Narcan or how to get it? If you are a family member of someone who uses, I have a business card back there. You can give me a call and we can schedule a training for you.
And with that, through the ARCW, it is free.
Oh, yes, sorry.
That is something very important to point out, that it is free to access. So I'm going to talk a little bit about over-the-counter availability. And I think before I get to that, on the issue of naloxone, it's one of those kind of misperceptions or kind of contentious topics. Because there's a lot of folks that'll say, you know, one of the biggest questions is, you know, aren't we giving people a get-out-of-jail-free card or you know, kind of getaway card? Aren't we going to have people push to the edge to see how high they can get? And then somebody's going to be there in the room to bring them back. And really the fact of the matter is barely anybody uses alone, but they surely do die alone a lot. And I think that that's something that when we look at that kind of concept of pushing, you know, someone to the edge to see how high they can get, I've heard stories of people that have had naloxone administered to them by emergency response, and they're mad because you took away their high. You just wasted all their money. Not fully understanding the fact that they were on death's door. And that's really talks to the strength of the addiction. So I guess I just kind of want to put that out there that, you know, there is that perception, but I do have to say there's no do-overs when you're dead. And we see in our overdose rates have been leveling off since 2012.
They're still not great. It's something we want to brag about, but they have been leveling off to, I believe, around a dozen a year. But that has to do with the increased utilization of naloxone or Narcan in the community. So I'm going to cover a little bit on the over-the-counter availability now that we have. And since December, like Josh had said, since December of 2015, you can now access naloxone over the counter. We put state statutes, Representative Nygren out of Marinette, who's kind of really led this effort through his HOPE legislation, which stands for Heroin, Opiate Prevention and Education legislation, really pushed forward a number of different policies, and this is one of them. This is one that will allow for pharmacies, essentially, here's some guidelines, for pharmacies to work under the same protocols or standing orders that they do for flu shots, to be able to administer flu shots. So a physician can do a cross-systems approach. So if you have a big conglomerate like CVS, which I'll talk about their program there, it's one doctor that's writing it for all the pharmacies in the state of Wisconsin. And with that legislation, that really allowed for us to open that up. And in my conversations with other prescribers, other pharmacies, there are a couple that are also looking at the possibility of increasing access to this drug. At this point, it hasn't been fully utilized, but I think it's because it hasn't been really promoted. So some of those guidelines, which you do have on the back of, it's a white sheet. I think you guys have it. It says summary of state-specific regulations pertaining to dispensing of naloxone. And that's really kind of some question and answers. But again, like I said, it works under standing order. When you go up to the counter, essentially they get some basic information before you get that medication. So they do collect your name. They do collect a little information on you. To my knowledge, there's no age restriction, so any caregivers, emergency workers, or facilities can attain that medication now over the counter. Locally, the nasal and injection versions are available over the counter. They have not gotten the auto injectors yet, which kind of look like an EpiPen. And then, like Josh said, many of our emergency responders use that Carpujet. Carpujet? Yes! Got it right. And it does get covered under their informed consent. And pharmacists, through this law, are required to provide some sort of education to the folks that they are prescribing that to. And that's kind of the handout that you have on the other side. It gives you a little bit more information on that, is what they hand out. And the pharmacies, CVS Pharmacies has put a policy in that their pharmacists do have to do some sort of training in order to be able to prescribe that medication. And at this time, there's no reporting requirements. Like Deb had mentioned, there's the prescription drug monitoring program, which you put in commonly abused medications like painkillers. There's no requirements on this yet, but it is something that we're going to be watching to see how many people access this service here locally. So in Marathon County, both CVS locations are carrying this medication, this life-saving medication. I think that's something we need to keep saying. It's a life-saving medication. The 3rd Avenue and Bridge Street location is one of those, and I did not know this until I was reaching out to our pharmacists that Target, as a national or as a company, its conglomerate, was bought out by CVS. So they're transitioning into a CVS pharmacy. So Target Pharmacy, I just called it that instead of CVS, formerly known as Target Pharmacy, over in Weston, also is carrying those medications. I had the pharmacist run them through to see how much they would cost. So if an individual or family member or friend or someone, again, this isn't necessarily just for drug users. This could be for someone that's on chronic pain care that you may be concerned about. This isn't, I just kind of got to put that out there. Also, if you're one that is on a chronic pain medication regimen, if you have a reaction to that medication, or if you mix that medication with alcohol or a different medication, this is for anyone that is suffering an opiate-related overdose. When they ran it through the system, the nasal version is actually cheaper than the muscular version, which surprised me a little bit. It's $41 when they ran it through for 2 doses. You get 2 doses with this over-the-counter prescription, and it's $53 for the intramuscular. They can run it through your insurance as they would with a flu shot. I'm not for sure. You'd have to check to see if they would cover it, but they can run it through your insurance. However, I cannot go in, because Eileen's using, with the intent that I cannot go in on her behalf and run it through my insurance. It has to go through whoever's getting that prescription.
But you could buy it for someone else if you didn't want it.
You could buy it, but I said that wrong. I could not have her insurance billed, and I went in to pick it up for her. It needs to go under mine. So, with that, you've got a lot of materials, a couple things to point out that are over there. This is one of the latest SCAOTA, State Council on Alcohol and Other Drug Reports. They have a whole section on harm reduction. It's over there. If you haven't seen it, you can also download it on our AOD partnership site. And there is another one that is linked specifically to 911 Good Samaritan laws. So essentially, you have limited prosecutions for if you seek medical attention for someone that you may be with that's overdosing. That went into play a couple years ago now, and I think it's 2013. And then they are putting one forward for alcohol-related overdoses as well. They're pushing that one through the House and the Senate as we speak. So it's a great law. It is saving lives, and people, like I said again, are not dying alone and getting the help that they need. So with that, I'm going to open it up to question and answers. And if we don't have too many, there's a video that I'll show you that shows what a person looks like that is overdosing, and a little bit more on the use of naloxone. So do we have any questions before I get to that video? Yes.
I do. So you're saying about that Good Samaritan law.
Yeah.
So going back to that case that we keep seeing about those people at that party,
Correct.
and they leave that girl.
Correct.
Are they good? Could they call 911 and be covered under the Good Samaritan?
There's limited liability on it, and I believe it specifically is. I got the law right here. So I had to make sure I don't say anything incorrectly. So immunity from criminal prosecution covers, they call it the ADR, is immune from prosecution under a statute for the possession of drug paraphernalia or under the possession of a controlled substance or controlled substance analog under the circumstances surrounding or leading to the commission of the act. So essentially what that means is that if you were using, like the pill commercial, for example, if you were holding pills that were not prescribed to you, that you may be immune to prosecution. But let's say that if you had heroin, for example, and you had an amount that would be more on the level of trafficking or dealing, you would not be immune. So if you had a pipe on you, you would potentially be immune to prosecution. So if there's no other questions.
You should say that on that commercial.
You know, and that's something that I think we need. It needs to be more out there.
Yeah.
Same thing with the accessibility of naloxone in our community. Yeah. More and more parents I hear from that's their worst fear is to come home and find their loved one in the bathroom. Yes.
What would happen if you used naloxone on someone that had drank too much alcohol?
It won't work. It's naloxone. Right. Naloxone is specific to the opiate receptors in your brain. Essentially, heroin or opiates attached to a spot in your brain that makes you feel that high, they come in and it kicks it right off. I mean, that's pretty much what it is. So medication-assisted treatment, Suboxone, is a mix of actually bupropion and naloxone. So that's kind of why with that one, it's another one where you're not supposed to get the high if you're taking it as prescribed. Because it manages it. Yes?
I have a question for both Carly and Stephanie. If you come across a situation, someone's coming in to get a clean needle, and you can tell they're addicted and they use and they have children, can you at least advise social services to help intervene in something like that? Because, you know, working with Aaron, we hear about the ACE, adverse childhood experience. I mean, can we be proactive?
I can. I'm a supervisor for Stephanie, and I can answer that. We've talked to social services about that, and social services looks for impairment of parenting. So because they use does not mean that they are impaired in their parenting. So that's how social services looks at it. So.
Okay, thanks.
Mm-hmm.
Okay, if there's no other questions, this video I'll probably end up cutting short, but just a reminder again, evaluations, if you need to do registration for CEUs, make sure you fill those out. All these materials will be uploaded and more. Actually, I'll include fact sheets on what wicked problems are, and a couple others that you don't have in your packets to the calendar by the end of the week, as well as our video will be posted by the end of the week. This is what it looks like when somebody's on the nod. You may have heard that term.
Naloxone. Generic equivalent to Narcan. Everybody calls it Narcan because more familiar. You see it in the movies. You see it. People talk about it on the street, but we distribute Naloxone, which is the same as Narcan, just generic and cheaper.
And as was alluded to, it is becoming more and more expensive as more and more attention comes to it.
Naloxone, it only works on opiates.
Heroin, morphine, oxycontin, Percocet, Dilaudid, Vicodin, methadone, codeine, Norco.
Not cocaine, not alcohol, none of those other things. But taking the opiate out of the picture is always helpful. So even if you think somebody's doing more than one substance, eliminating the opiate only could help.
I remember the day that Mike told me he was an addict. He actually came home with a bottle of Narcan and told me what it was, told me how to use it, and I was glad because then I have the opportunity to actually use the Narcan and save his life.
Woke up that morning sick, like every morning, and he drew it up and he did his hit, and then I'm mixing up mine, and I look over at him, and he's like really knotted, really fucked up. So I touch him and say, "You okay?" He says, "Yeah, I'm all right." And then 2 minutes later, same thing. "Babe, you okay?" "Yeah, he's fine." That's what he said. And then I remember him just going backwards on that bed on the floor.
And I just remember jumping across the table, and when I got down to him, I could see his lips were blue. And I thought, oh shit, it is for real, he's dying. I took my knuckles across his chest bone, across his lips, and he nothing, no response. So what? We flipped him on his side and cleaned his mouth out, made sure he had nothing in his mouth. Had him on his back, tilted his head the way you're supposed to. I did 2 quick breaths like you're supposed to do into his mouth, and I wasn't thinking straight, so the air came right back out his nose because I forgot to pinch his nose. And so then I had to do it again, pinch his nose and 2 quick breaths. And then you guys had to go get the Narcan. was there breathing for him, and then when you guys ran back in, gave me the Narcan, I loaded up 1 cc, which is all you're really supposed to give him. You know, you can just go right through the clothing, so I did. I just hit him right in the upper arm, that muscle up there.
They come right off like that. And snug it right up like that. Don't even have to take the cap off.
Again, with the increased use of the nasal, which is easier to administer, the auto-injector, which is pre-drawn, it does make it a lot easier to administer than when this video was created.
And that was it. And then he took that big breath. Oh, there he is. He's back from dead.
You just died. We gotta get you Narcan.
Wait, buddy. You all right?
We just hit you with Narcan.
I remember we kept telling him what he already knew. Half an hour from now, that Narcan's gonna wear off. Your high is gonna come back. And in fact, your OD might come back, which is why you and I had to stay with him for a couple hours.
Yeah.
You stayed with him a long time.
Oh yeah, I married him. Of course I did.
Oh, good morning.
I hit him once in the ass, and it took about 3 to 5 minutes. You know, he took that big gasp of air, and once you hear that, you know it's gonna be all good. From my experience, anyway, you know.
What happened? What's going on? Where am I?
I don't drink your shit. You fucking shot me with that shit and took all my dope away. You know, I don't have fucking money to get another bag. Oh my god. I'm sick. I need another bag.
We're off.
When it comes to opiate use, shame kills because it silences people. It keeps them from talking. It keeps them from telling the people who might save them.
A package like this with a couple syringes and a bottle of Narcan in it.
Never use alone if at all possible.
Always make sure you have Narcan on you. Know where the nearest telephone is to dial 911. Do not mix your heroin with downers such as benzos or any other opiate or alcohol. It's a lethal combination.
Pam's absolutely right. Everyone knows you shouldn't mix downers with opiates. However, what you may not know is that mixing uppers, cocaine, amphetamines, with opiates increases your risk of overdose as well.
If you're coming out of prison or you have a clean system, use way less than you did before you got locked up or whatever.
Taste the shot, you know.
Inject a little bit at a time, see how you feel, and then go ahead with the rest.
I know, back in the old days, it was a lot of work. Some people would shoot them up with milk, sugar water. I've seen people try to shoot them with salt water. My philosophy was I used to almost beat them silly, beat them black and blue, keep them up, keep them from falling, rub them in the snow, drag them on the snow or ice water, something to keep them from going further into their knot. It was a lot of work. Thank God for Narcan.
Michael! Michael! Michael!
Okay, I'm gonna, with respect to time, I'm gonna stop it there. You have the link in your handouts if you want to watch the last minute or so. I want to thank you guys all again for coming. Just want to again, point out that this is something that is needed in our community in order for us to address this problem. Please make sure you take additional handouts on the side. Share this video with others. Or share our meeting video, I should say, and this video with others. If you have any questions, please let me know. And again, thanks for coming. Please leave your evaluations if you want in your spot and take extra handouts. Have a good rest of your day.